Good afternoon. My name is Kendrick Scott. Today I will be talking to you about IT governance. As the new hospital administrator, my goal is to become part of the team. How am I to become part of the team? Aim to improve the health population by enhancing the patient experience while also reducing the health costs. How can I achieve this? By establishing the IT governance framework, upgrading the electronic health record system by implementing the properly health and data tools, all while ensuring that the patients have a patient-centered experience in everything that we do. Some of the things I'm going to talk about right now, the first thing I'm going to talk about is the enterprise of the wide IT governance related to organizational change. First and foremost, aligning the strategic and clinical operation along with the financial needs of the hospital. It provides structure, accountability, and standardization across the board, like risk management, the proper implementation and regulations of HIPAA, data security, and ensuring that everyone within the organization is well within compliance. The organizational change is the implementation of the electronic health records, value-based care, and telehealth. But how do you do that? You have four core functions within the IT department. The first of which is the planning. The second is the system acquisitions and implementation. The third is data management. And last but not least is support. So let's talk about the planning. You have to understand the organizational goals. You have to have a budget, and you also have to make sure and ensure that everyone is well within the compliance. When it comes to the system, that is, we're talking about the electronic health records and also the implementation of that, which leads me to the data management. That's the accessibility, the data control, and the clinic decision-making ability to do so. How to ensure all of those things go? You have to have a support system, ensuring that it's reliable, the usability, you have the technical support, and you have a good monitoring system. So with that being said, the significance of the data transformation. Data transformation is significant for many reasons. So, since becoming digital, the healthcare industry have been able to effectively implement real-time diagnosis, improve the quality of care, enhance the workflow, and not reducing the burnouts, and ultimately enhancing the patient's experience. The way that we do that, we enabling the clinicians to have timely sharing of information across the care board, the care team, which reduce duplication of medical records and reducing medical errors. So if I were to suggest something to be implemented into that, it would be the clinical decision support system. And the reason why I would do so, because that allows real-time alerts, such as if someone is allergic to anything, evidence-based recommendations, and being able to diagnose the system and help them make proper decisions and reduce patient risk. The way that I would do that, I would embed that into the EHR system. Now, one of the other things we're going to talk about today is the difference between capital and operation IT budget. In short, capital budget is a long-term investment and how much it's going to cost to get everything done and added into multiple years. So that's like the EHR system, the servers, etc. When it comes to the operational budget, it is just what it sounds like. What will it take for this to operate? That is the annual cost. That is the maintenance budget of everything that you need. So that's yearly. Over the course of this PowerPoint, I have discussed the modernization of Ashford Hospital IT system. But what I want you to take with you is not only would I be able to improve the capability and have a more accurate system for it to be interoperational, but it will become a more patient-centered system. And that will also give us an opportunity to show the community that we are trying to achieve the triple aim, which is to improve patient care, improve the population health, and to reduce the costs. Thank you for your time and have a blessed day.